So good morning, everyone. I'm Caterina Scarpati from Change Management Team for Regulatory Procedure Management. And welcome to all of you to this Regulatory Procedure Management for Product Lifecycle Management training for network stakeholders in view of our upcoming rollout for selected regulatory procedures on IRIS. So please note, first of all, that this session is being recorded. We will make available the recording on the EMA corporate website on the event webpage, and as well on the EMA's YouTube channel. Please note that at certain point through the session, you will have some Q&A session where you will be able to ask questions on the materials the team will have just showed to you through our interaction tool Slido. And here is the agenda for this session. So first, Maddalena Dutamar, the product owner, will show you a background of the product, the timeline, the main changes for you. Then Simona Griniene, our regulatory procedure management subject matter experts, will go through the IRIS basics and the access to IRIS. And she will also show you case management on network portal, cases in IRIS for committee meetings. After that, we will go through a brief Q&A session. Then Sara Santos, our other regulatory procedure management subject matter experts, will walk you through how it is working on documents related to IRIS procedures in SharePoint. After that, we'll have another Q&A session. Then Simona will go through the next steps, and then we will close the session. So, as I mentioned earlier, to send your questions, you can use the interaction tool Slido. To join the session there, you can either use the Q&A code, the QR code you see on this slide, or you can go to the Slido website and enter the code you see here. After you access Slido, you will be able to send or upvote the questions you want to hear answered. Indeed, the questions will be answered in order of the most upvoted ones. We will share the questions on screen and manage live the Q&A session, but please note that also the questions that will not be answered live will be answered in writing. Now I leave the floor to Maddalena to go through the background. Thank you.
Morning, and thank you, colleagues, for attending this session. We have prepared an extensive slide deck and training for the network ahead of our go live next week. I will give you a brief introduction and landscape of regulatory procedure management and its transition to IRIS. As some of you or many of you already know, the IRIS journey started in 2018, where EMA transitioned to the platform relatively simple and standalone procedures in order to learn the capabilities of the platform. We are currently in stage 2, where we have developed together with an extensive network of IT experts and business experts, the core process for regulatory procedures and the variations, Article 61.3 and marketing authorization transfers, which are subject to our first rollout with a limited set of products, as we will come into detail in the next slides. In next steps, we will move more procedures, so we'll transition the rest of the regulatory procedures and integrate necessary changes, improve in our pursuit to create new opportunities for efficiencies. What it means for us and for our users is that we envisage a controlled transition to de-risk the core business, which it's a extensive collaboration between network and DMA and of course the industry. And in this way, procedures will be developed and transitioned in phases in a lean and simple way, but in the shortest time possible. So this will enable a gradual learning curve and evolve with the user's feedback. Will enable incremental migration of procedural data, starting with products with lower complexity in terms of life cycle. And of course, we also need to meet the new fee regulation timeline implementation. In the next slide, we have a roadmap which depicts the status quo and the future plans we have. So in the first swim lane, we have Epic One, which is just a box, let's say so, of procedures of work to be implemented. And here we have developed the core process, as mentioned, the variations, which are veterinary and human processes, the marketing authorization transfers for veterinary and human products, and Article 61.3 notification. So we are here now just at the cusp of go live, which will happen next week on 23rd of January. And after this, we will have a maintenance based on business prioritization. What is also important, our go live will be happening on a limited number of products. There would be around 100 in total, human and vet products. And this will basically suit the principles I've explained before. In the next piece of work called Epic 2, we will develop more processes which are planned for this year in order to ensure all processes of any product's life cycle can be managed in IRIS, and the plan is to have by 2025 a full transition of all products life cycles on the post-authorization part. And next epics, of course, will include, among others, the marketing authorization application and the commissioning of SAP. In the next slide, we want to explain what is the focus and the next steps. So in the first rollout of variations, Article 61 notifications and marketing authorization transfer, which takes place next week on 23rd of January, we will go live with a subset of products, human and vet, being able to carry a full life cycle only on variations, Article 61.3 notification and marketing authorization transfer. So these will be exclusively available in IRIS, managed in IRIS, and visible on the network portal. And for these only products, we will collaborate on the IRIS platform. The biggest impact as of now is actually the access the network users need to request in order to be able to log in to the network portal and have access to the SharePoint documents. After the go live, based on the experience and the feedback we receive, we will onboard additional functionalities, and by January 2025, all post-authorization processes will be managed in IRIS, together, of course, with the relevant products. A very important part of this training, and Simona will go in detail also in the next part of the training, are changes which are going to be implemented in IRIS. One of the most important is the procedure number, and we have sent already some information to the network colleagues to explain what the new procedure number will look like. And this is mainly a simplified number, including the process type and a random number given by the system. However, the good part is that because the network portal has increased, so has more data on the procedures, details on the content of the procedure and on the process type, the status and other information will be available on the portal, allowing the network to carry on with their daily tasks. In the next slide, we are also introducing a new way of communication. We will, so the EMA and the case management will send notifications to the rapporteurs and the committee Udranet mailboxes, together with a link to SharePoint, where the templates are located, and also other procedure information in order to be accessed by network user and to enable collaboration. So the notification will contain all the information you need. And of course, what is a big change is that no documents can be attached. So from either sides, from IRIS, EMA, and also from the network. And this means that the work will take place solely in SharePoint, and only the communication with the relevant links will be sent via these notifications and emails. In the next slide is an example of the notification email to rapporteur. The slides will be shared, so you will have time to look into details on this. And in the next slide, another important piece of the change is actually working with documents SharePoint. And many of you already probably work on SharePoint with scientific advice or orphan medicines. So this is not very new to you, and maybe also in your local network systems, you already have SharePoint. SharePoint is a very good system to enable collaboration. You will have access to the templates and to the documents necessary for assessment. And of course, the committee meetings will be covered by this in terms of uploading the presentation and any other documents for committee meetings directly in the case folder in SharePoint. There would be no need to duplicate the documents in MMD for the products in scope. In the next slide, you will have just a quick overview of how the folders look in SharePoint. This is similar to what we have in Dream today. However, it's visible to you and it will enable transparency for case management. We also have many parts which stay the same. So we have the timetables remain the same. Procedures are managed in IRIS and will be added to agenda and minutes for completeness and publication. So this will be the part of transition we are taking care of. The content of documentation, the guarantee of confidentiality, and the submission of response, initial submission and responses will take place in ECTD. So common repository will be there to ensure the submission and the data is going to be available for the network. It's important to reemphasize that the submission process remains the same. It's just the case management which has been transferred to IRIS. And with this, I will hand over to my colleague Simona first. And thank you very much for your attention. We will have 2 Q&A sessions where you will be will have the opportunity to ask your questions. Thank you.
Thank you, Madalina. Good morning, everyone. My name is Mona Gliene, and I will guide you through the rest of the slides, starting now first about how to get access to IRIS. So this slide shows you the link to register via EMA portal if you have not done it yet. just maybe to say that all committee members and alternates by default will be granted access to IRIS system already. But if you are not committee member, but you work for NCA and you will be impacted by the first rollout of the procedures, so you need to request this access, and it will be approved by the administrator assigned within each NCA. So you see the link, how to request the access. You need to associate it with your NCA and organization ID. And below the picture shows which role you need to select as well, and following the selection of your organization. And if we can go to the next slide, it's the role is here, IRIS competent authority user. You select this role, and just also important that the email address which you provide allows you to be able to access IRIS. So that means that it needs to be associated with NCA, as given example in the slides. Either it's external NCA email address or it's internal email address. And just to request to submit your request to get access to IRIS. It's quite straightforward, and I hope that some of you are already familiar with the system, requesting access to other different EMA applications or databases already. If we can go to the next slide. Just a brief summary of what type of access for IRIS we have. So as you see, the middle column shows that the IRIS competent authority user administrator is assigned at each NCA, and he approves and validates and also makes sure removes the access when the person leaves at each NCA. So the administrator role doesn't have access to IRIS, but it's just the task is to approve access to the rest of the stuff. And IRIS competent authority user, they access to the IRIS network portal to search for open, ongoing, and closed cases. And also they have access to procedure documents in SharePoint as well. So all NCAs have their user administrators assigned as far as we are aware. And as I already mentioned, the committee members are already assigned the access to IRIS. And in case if you are the NCA user, assessor, or any other role within your organization, you need to have access, just request as per previous slide presented. So if we can go to the next one. This illustrates what roles can also do in SharePoint. The SharePoint presentation will come at a later stage than our today's webinar. But here you can see that the middle column, EMA Regulatory User Network Portal, you can create, upload files, edit files, to do searches in the SharePoint, delete, move or rename files and folders, which, is the last column. Yeah, it's not possible. And also you cannot see if there are any folders as marked as private email folders. So yeah, for network users, it's the last column. Apologies for my mistake. And the first two are for EMA users. So just as already presented by Madalina, you will be empowered to upload any additional documents. No need anymore to send it via email or via UTRA links, and to ask the secretariats or procedure management people at EMA to upload those documents, or you can do it directly in IRIS SharePoint case related to the relevant procedure. If we can go to the next slide. Yes, so this was all about the access, and now I would like to move to IRIS introduction, a little bit of basics of IRIS for your better overview and understanding how the system works. So we have IRIS portal, and it consists in three main components, which is public area. It's used for public registers and lists, guidances for applicants, and different kind of forums. So there is no access required. Any public member can connect to IRIS and to access this type of information. Another component, also very important, is an industry portal. And then we have industry credentials assigned to industry users. Every organization is as registered in our SPOR database under OMS. They also grant access to their people who needs to access the IRIS system and work on the procedures. And this But also important component is a network portal, where the network users, Commission and EMA also have access, and they could see the data provided to the network portal from the main IRIS system, as it's called, CRM, managed by EMA. And for this, every network user needs to have access, as mentioned previously, and to search for information and to access any other different data, which will be demonstrated later as well. The let's say, the biggest part is a Dynamics 365 database CRM, and it's managed by EMA, where EMA manages all the procedures on our system, and part of this data is exposed either to the industry portal or to the network portal. Indeed, based on confidentiality things and the relevance of the information, which stakeholders needs to access which type of information. And also, which will be of your relevance, is a document repository. It's a SharePoint CRM site, or we just used to call it IRIS SharePoint as well. So where all the documents are stored. So the documents might be related to the cases procedures managed in IRIS, or also there are committee libraries where we can just upload the documents which are not procedure related, but if it is for committee and secretariat collaboration, you can use this place to collaborate on the documents using the IRIS SharePoint functionalities and all the capabilities. So this is on the main IRIS components, just for your better overview and understanding how IRIS works. And if we can go to the next slide, a little bit of user requirements for IRIS. So it's really, I think the majority of you maybe already are using IRIS, and all NCAs are having access for scientific advice procedures, for COM procedures as well. So there is nothing really special. Any modern web browser allows you to access the system, which are listed here in the slide, just for your awareness as well. And if we can go to the next one. So this is just a little bit of user interface, how it looks like. So on the network portal side, once you will connect to the network portal, you search for all cases, or there are some other different views which I will demonstrate later today. And just, you see the number of different filters you can apply, the groupings as well. It allows you from this view to go directly into the documents stored in SharePoint, which is called case folder. It's highlighted in green, or submission folder, as well as where you can access documents provided by the industry. And just maybe to mention that the documents which are currently shared by the industry through the UDRLink will be shared through the IRIS industry portal. And the rest, as mentioned by Madalina, the initial dossier and responses to listed questions will continue as it is now through ECTD. So nothing changes. And the main documents for, let's say, drafting the assessment report will be under evaluation, and once document adopted will be under the outcomes folder. So just to have the final versions of all the documents. And if we go to the next one, so this is a bit of a view of committee view. Once you select the relevant committee, you can select the meeting, and you can see all the cases which are associated to that committee meeting as per timetables, or if there is a need to add ad hoc case to the committee meeting. And what I also mentioned, that we have a location for documents which do not belong to the cases created in IRIS, but it requires collaboration within the network, and any SharePoint committee library location can be used for it. And it's already used by several committees as well to collaborate on comments on the minutes or agenda, etc. And if we can go to the next one. So this is about how to connect to the IRIS platform for the first time with described steps. Accessing the IRIS portal with sign-in credentials, and the next main important step is to set up a multi-factor authentication as well. Just slides will be shared just for your reference once you will be ready to connect to the portal, that you could have this by hand instructions. We can go now to the next slide, Katerina. So this is a little bit about how to set up a multi-factor authentication. If it is one time set up, if it's not yet done, so you will be required to process through the steps. But if you are already accessing the some other EMA databases and applications, so it's not relevant for you. And we can go to the next one. So I will just take you now to the network portal. So what I would like here to show you how the cases management is looking on the network portal, and how you could see the cases under the committee meetings, and review my ongoing cases and favorite cases. These are the main views you can use to help your daily work. So just I guess you can see my screen. So this is what we said about once you connect to the network portal, and the main tabs for network users to be used are the cases, where you can go to search all cases or my ongoing cases, or committee meeting cases as well. Just worth to mention, we are still need to improve a little bit of assigning cases to the committee meetings, but just for your overview, that you know where you can find those cases related to the committee meetings. So just here, search all cases. As you can see, you can have a different types of filters. You would like to narrow down your searches. If you are interested in some type of a procedure, just also maybe worth to emphasize that we used the procedure now is for case, and very often in our communication you can hear the case, so it's equal the procedure. But in IRIS, every procedure has its case, and here you can see that the column name has its case number, case type, so it's actually equals what we mean by procedure. So you can select a different type of a procedure, different type of the case. You would like to narrow down your searches. You can also select by the committee, to which committee is assigned, or status reason, if it is in under evaluation or under validation. It also allows you to filter by different phases of the procedures as well. And by the condition, it's a free text, or rapporteur name, or resource name. It's been improved once we implemented the variations, because not only rapporteur or co-rapporteur are involved in our procedures, as it might have more than one committee meeting and with different roles across the committee through the variations. So that's why we had to introduce a new resource name, where you can type a name of any role involved in the procedures within the case, and to search for those cases. Or just select a different role as well. It's a drop-down. Here you can also select an NCA if you're interested to see all the procedures where the NCA is involved. So that means if there is any role from that NCA assigned to the procedure, so those cases will appear here. Or the same by the NCA country as well. And clicking on apply filters, you can just narrow down to what you would like to see. And then the cases appears with a case number, what was also presented in the slides, case type, case subject, because it's the portal is relevant for different types of procedures. So other types of procedures, we use the case subject, but for variations, let's say it's the most important is invented name and active substance, where we put the name of the product and the substance of a product. And each product in IRIS has its own product number as well, and you can see it here with the customer, so marketing authorization holder. Operations, we don't have a condition, but as mentioned, the same page applicable to other procedures as well, and the direct links to the submission folder and the case folder as well. So the case folder is the same folder as was shown. So this is the subfolder structure where you can access all the different documents related to the procedure. And the submission folder also has two subfolders. So input from industry, where you can access the documents submitted by the industry, and output from EMA. So these are the documents which EMA shared with industry as well. So both subfolders are accessible to you as well. And the name of the rapporteur, co-rapporteur, and prop-rapporteur, we decided to go for 3 main rapporteurs, taking into consideration that it will be also easier to, during the committee meetings as well, to filter by those main roles within the procedure. You can also see who is scientific officer leading at EMA side the procedure, if there are any notes to be exposed to the network portal, and the submission date, start date, and status, sub-status, and when the case was last defined. So this is the main information on the view. Every procedure or case has its active number, and clicking on the active number takes you actually to the more details on the procedures. Some may be whatever you already can see in the view, but some are additional, as for example, timetables. Here you can access the full timetable of the procedure, or all timetables if there is several assigned to the procedure, as it happens if we have a assigned. And the plan date and actual date, once it's recorded by EMA in CRM, it will be exposed automatically here on Dynamic Approach. So anytime you need to be reminded on the deadline of a procedure, you can go to the network portal, access this information from the form, and or to see what is the next step as well. So it also has the information on the precise scope as proposed by the MAF. Approved scope, if there are some changes in comparison to the precise scope, if there is any refuse scope as well, so grounds for opinion, grounds for refusal, and the links to the subfolders as well from the form are available, and more information on the products involved in the procedure. So authorization products involved in the procedure and packaged products as well. And you can see the blue text means that you can also, it's clickable and you can get more information either product or packaged product or authorization product. So this is also additional information which may be also useful for you during the evaluation process. And the scope outcome as well can be accessible in this form. So with scope number, scope outcome, if it is refused or withdrawn or accepted as well, and other information related to the scope. And also at the end of the form, you can access the all case resources involved in the procedure. As you will not be able to see them all in the columns, but if there are more resources involved, all will be listed in this form. So this is also will be useful if you would like to know who is involved in the assessment of the procedure. So this is on the form, and also now I would like to show you the case details as at committee meetings. So this committee meetings allows you to access the different month of the meeting. And as I'm here, I selected this HMP, let's say February 2024, and applying the filters, I can see all the cases associated with committee meeting. But just, yeah, we will inform you separately. This is the UET environment, but we still need to fix one thing to be able to expose patients to committee meetings. But the rest of the procedures, you can all see, already visit here in this view. What is also important to show you is about my ongoing cases. So as I already mentioned, and this can be accessible also through the all cases view. And my ongoing cases, it's where I am as a team member involved in one or another procedure case. So clicking on this, I can see all the cases for which I have one or another role. And I think it's also easier for quick access of the procedures to be able to see. Currently, I don't have any cases where I'm involved, but here you will be able to see the cases for which you have one or another role with the same information in the as provided here. So this is on those cases Also important that there is possibility if you are not working on the case of a procedure, but you are interested to follow one or another case, you also can add the case under my favorite cases. So selecting, as I showed you previously, from the committee meetings and clicking the arrow on the right side of the case, you can just add to favorites, and it will the case will be appearing under your under favorites view, and as long as you will remove it from your favorites view the same way as I just demonstrated. So this is on the network portal and on different types of views. And as also demonstrated by Madalina, the email example. So just to go back on this as well, as you can see, the email has a direct links to IRIS network portal. And also it has a procedural information, including the name of the product for you if you would like to search for this procedure or for procedure number. And but also you can access it directly from the email received by EMA, either directly go into the network portal or directly go into the case folders in SharePoint. So just I wanted to demonstrate this that it will be really as is now receiving, but with direct links rather than attachments and uploading different types of information. Yourself, you can access the system 24/7 and to see the most up-to-date documents, as it will be also demonstrated how the SharePoint will work by colleagues. So this is why I can stop my my demonstration and move back to the question session.
Thank you, Simona. So I will now go to Slido and share my screen so that we can start answering your questions. Okay, so first question. If we have ongoing variation submissions in, will this be handled outside of a new IRIS system? So will this be implemented only for items submitted after 23rd of January 2024?
Yeah, so just to answer that, variation submissions in IRIS will be managed only for this first set of products that we are moving into IRIS. The rest products which remains assignment remains the management of the procedures doesn't change and remains as it is. Only for this preset of the products, which was circulated to the network as well, and the access is also available in on IRIS SharePoint location under the committee library. The full list of the products will be managed in IRIS.
And just to complement, indeed, only the newly submitted from 23rd of January will be managed in IRIS. So if there is a variation we have on assignment, we won't transition it to IRIS for management. It will be transition just for the record and the case management, but not on the record for the life cycle, but not for the case management. So we start basically fresh with newly submitted procedures, as Simona mentioned, for the products in scope only.
Okay, thank you. The next question, sequence number is needed in the notification. Could you please register it in the title?
Yeah, we can, because we already have it. And just to be honest, I think we identify that we are a bit of, we need to harmonize our template subjects, because for some of the templates, the sequence number is already there. So we will make sure that all our notification email templates has the sequence number. Yeah, thank you for the question.
Okay, next one. Will MAH network users receive emails advising that the case status has been changed, or will MAH be expected to monitor the IRIS site?
The notifications to the companies will remain as it is now. So if we are moving from one stage from validation to evaluation, they will receive an email that also that the positive validation has been agreed, and this is the timetables you can access through the IRIS portal. So to the industry, it's also the communication notification is still active. It's not that silently they need to go and to check the procedure. Nothing changes, but it's just the access to information through the IRIS.
Okay, thank you, Simona. Next question. Which information will not be sent anymore once the product is managed by IRIS? Please provide details. Excel of ongoing variations, Annex C.
I think we need a bit of more clarification to whom this is. This is to be sent, because the main idea of the network portal is that it empowers the network users to access the information by themselves. So actually, there is no need for EMA side to generate anything unless, let's say, we identify that there is still something missing, and as transitional period, we can generate some lists if it's not, the information is not accessible through the network portal. So it would be also good to have more information on this. What type of a procedure is to be needed, and just to analyze for us if for transition we still need to generate. But from our point of view, we would see that everything can be accessed, or the main parts can be accessed through the network portal. And just maybe also to say that will come in the next slides, but it's related to the question that we organize a technical seminar on the mid of February with NCIT people, so maybe those questions also can be taken.
Okay, so I'll get the next question. Could you share today's presentation, please? So of course we will share today's presentation on the EMA website, in particular on the event webpage. So if you search in EMA website for the name of this event, you will find the presentation there in some days, so by the end of this week. Thank you. Then next question. It was not clear from the presentation if in IRIS the MA procedures can be identified using the CHMP CVMP procedure number or application number. So here we have the number being the unchanged part.
The procedure number, as it was presented in the slides, will change. And it's just that for some procedures which are now transferred from SIMED, we still provide with the EMA SIMED number, but not as a procedure number as such. It's a product number from SIMED, which can also be within the system and within the documentation. But the procedure as we are currently having now generated, or actually it's manually maintained for the SIMED, it will discontinue, and the new IRIS procedure that's presented in the presentation will only be applicable.
Okay, thank you.
Just complement in case we need, so we could add a filter on human and veterinary domain. If that's not, so if the information we provide, such as the committee filter or the rapporteur filter or even the process type filter, if there is a need to include other filters, we could take that on board. However, it's good to also have more feedback once go live. Will happen in next week. We could have more feedback and see what other filters or improvements will be necessary to ensure that your work is not.
Okay, thank you, Madalina. Next one. By case number is not easy to identify the procedure, and if we want to give comments, need to go deep into the case. That is too much time consuming.
Yes, just fully looking into the procedure number, we cannot identify, let's say, the product, etc. So that's why all the communication and the portal use, they have in parallel the product number, the product name, sorry, even active substance or the type of a procedure. which is more or less the same information as we are currently having in procedure numbers as given from the Simon system. Yes, indeed, you have to look it into from the, let's say, from broader perspective, just to have it when you need to search for the information, more data, which would help you, but it will be always provided either by the emails or from the portal view or within let's say, the documents. So we understand this, but we think that it can be mitigated. Just learning the system and trying to use the new way or having the procedure numbers.
Thank you, Simona. Next question. Did I understand it correctly that the submission dossier from the MAH will continue to be at the common repository and not in IRIS?
Yes, correct. The submission dossier and responses to list of questions, RSIs will remain as it is now. Will be, ECTD.
Okay. Next question. During the PRAC meeting, it was mentioned that notification will be sent to rapporteur team. It was not said that it will be sent exclusively to the rapporteur person. Could then it be sent to several people?
Yeah, I can reply because it was me who was doing the presentation to PRAC. I don't know where this confusion is coming from, but this was exactly the same slide as we presented here, which mentions that the notifications will be sent directly to the rapporteurs, and that generic email addresses used within NCAs cannot be accepted by the system as it's linked with access rights, and access are provided to the person. But as mitigation as well, we provided with the possibility also to set up a out-of-forward rules if it is necessary, if it is needed within NCA, and we will take it also for discussion into the technical seminar. Because some NCAs, as I understood, they are already doing this out-of-forward, or some of them issue for them, and it's fine to receive an email directly to the rapporteurs or any team resources, or let's say officially involved or as having an official role within the case. But this can be also discussed, and your IT colleagues will be able to support you and to help you to set up out-of-forward rules if you are using any generic email addresses. But for the time being, let's say to send it from the system for specific cases to the specific, let's say, roles involved, and to use a generic, it's not possible. This is the way how the system is designed.
Okay, thank you. Next one. How could we see all cases closed and ongoing for one product? You see them all together in one screen.
Yeah, we will demonstrate you the answer to that question.
All right, so we're just going to take out all the filters. You can select the product. The easiest way is to have this product number, which is coming from IRIS. We perform a search, which will give you the list of all procedures, not only the life cycle, but for example, scientific advice or orphan maintenance application. And if you want to narrow it down, you can go on case category, and that will only show you the life cycle. So the regulatory procedure management is what we want today. This is the quickest way to date to identify life cycle, so to follow through the procedures, because it's understandable there may be parallel procedures and we need to have an overview. You can also click control click and open new window if you want to have look at different cases for comparison, like precise scope, what did this case affect annexes, when was the submission date and the timetable and so on. So it's possible the filters are quite flexible, but of course we are also waiting for your feedback once you get to test it.
Okay, thank you, Madalina. Next question. So this person participates in a drafting group with a similar structure and document circulation. Will the PL provide a rolling agenda minute to keep track of the critical deadlines and each one's deliverables?
Well, in principle, I'm not very clear actually about the question, but in principle, the process doesn't change if it's not really enforced by the system. So if you have, if you need to have some communication and some agreement with the PL, of course, that is going to be possible. Also, what we need to maybe mention at this time is that with this first rollout, we will have very few, if any, procedures going to the committees. So we'll have less than 10 type 2 variations, which will be quality mainly. So most of our procedures be type 1 variations and simpler VRAs. This will also help us maybe establish some of the parts of the process in case we need to change it. But in principle, we won't change processes if they're not enforced by the system.
Okay, thank you. Next question. Limited no access to CRM for assessment requires that committee members need to do all the administrative work on uploading documents.
I can take this question. So it's just anyone from NCA can have access to IRIS, whether it's a assistant or administrator, just as presented in the slides, how to request access. And as long as this person has an NCA email address, can get access to IRIS. What was related to the committees, I just wanted to say that currently all committee members have been granted access to IRIS. So there is no need for committee member or alternate to request access unless you are completely new, but it's still the process in place set up for secretariats and expert management team that by default is granted access to all committee members and alternates. But the rest of the NCA staff can request access from as what presented before. So anyone from NCA can have access to help to support committee members, rapporteurs, etc., with their work and be able to access information or the necessary documents. So I hope, it clarifies the confusion. Thank you.
Thank you, Simona. Next question. In IRIS, a product has several numbers, PRD, ID. Could you please explain the difference? Will they change? How could we relate the assignment number with the PRD number?
Sure. Okay, we'll share as well our screen. Yeah.
So the product number, this PRD number, it's a random number given by IRIS. This is how the system works. In the back end, we also have actually the EMA assignment number. We'll have to agree together with everyone and the other processes if we want to show it here. The PRD number, it's a more complex number in terms of data model because it's clickable and it could bring on the IRIS CRM EMA side more details. So that's why we showed it here, and it's also relevant for processes like scientific advice, orphan medicines, because it's not only can be also other type of product, not the product we know.
Sorry, Madalina, we cannot see your screen.
Oh, okay. Maybe we could.
All right. So now.
Okay, now, yeah. Thank you.
So this PRD number, it's like a universal numbering system. So that brings together concept for IRIS. That's why it's here. If we show another column with a assignment number, this should be probably subject to agreement. The question was also related to so if you click in the case, you would also have the EMA number, the one we are talking about, the number coming from SciMed. So this is available also, but we do want to show also the IRIS code because it's really something we want to use as a common language for the cases. I don't really, I'm not able to follow on the ID. Maybe I missed it. But the relationship between SIMED and the PRD number is actually the product, and it's visible on our end. We could nevertheless discuss and expose it if that's something we need to look into.
Yeah, and also we have actually a clear slide which we can include in presentation on the product number, the structure and the hierarchy structure from IRIS, so it might be also useful for you. So we will include this slide in the presentation as well.
Yes, because exactly, for example, each part of the product, so we have the umbrella, the authorization product, which is the SIMED product as we know, but then, there are combinations of strengths and pharmaceutical forms, which are medicinal products, and going below presentations and so on. So based on the IDMP structure data model, and all these have a PRD number just to, it's a unique identifier. So hence, each of these levels will have their number based on the data model. That's something which came actually from the IDMP model, and PMS also has a different numbering system. The products numbers will not change for the time being. I think this is something we will need to look into the future, but for now we are not changing any product numbers.
Okay, thank you. Next question. Invented name can change throughout the product life cycle. EMA number should also be on the opening page in IRIS for the ease of quick access or search. From the NCA aspect, this is more relevant than case number or any other number.
Okay, but this is a requirement.
Yeah, that's an observation. Yeah. Okay. Then this person didn't get how the member state comments will be shared directly into IRIS documents.
Yes, maybe you will see once we go through the slides by Sarah on working on IRIS SharePoint. But this is what was in the slides, that you have two options, because you can access the document to the right to edit document. If you think that you would like to edit the assessment report and to enter your comments, if it is something typo or very, very minor comment, you can do it directly in the document. If you are currently doing it right now, adding the comment in the assessment report and send it back to the rapporteur, so you can do it the same way. Or if your comments are like a major, or you would like to provide it within the comments template, you can also do it and upload the comments template directly in the SharePoint location for this procedure. So no need also to send it, and for completeness, we'll have all the documents within one place as well. So it's both ways. And it's still, the business is finalizing the process on how to work on those procedures. But as Madalina mentioned, for this first rollout, let's say it will be a really very limited number of procedures. And I think we will really can gain some more experience with you using the system and seeing what works very good or what needs to be done, let's say, differently, that we could all benefit from the system. I think this is why we are going through this low number of the product, just to gain experience within the whole network on different aspects of the new ways of working and using the system.
Okay, thank you, Simona. Next question. Will the EMA PTL move all templates into IRIS shared space, or will the relevant rapporteur team need to download from website and move into shared space?
No. IMA will do this job. The templates will be generated by a procedure assistant or procedure lead, and those templates will be saved in the relevant subfolder location. And as we demonstrated, the email message saying that a procedure validated, and please access the assessment report under the evaluation folder. So once you will receive this email, you either go directly through the link to access those documents, or if you wish, you can also see from the network portal as well. You will be able to access those documents. Now, rapporteur's team will not have to generate the templates themselves. It will be done as it is now done by EMA and at the same time as it is done now. Yeah, but just the difference that no attachments will be sent, only the links to the location where you can access the templates.
Okay, thank you. Next question. So we will not receive Annex C contains timetables or procedures such as MEA, signals. We need this in one lot for planning our workload.
So these templates, as far as I can understand, they are more applicable to other types of procedures. That's in principle reports and documents you receive today, you will continue to receive unless they are available in IRIS. So for this, for example, this type of document, it's not in scope currently, and you will receive it as of today, basically.
Okay, thank you, Madalena. Next question. Will there be a way to tag our frequent or ongoing procedures or products to allow a quick access?
So this is what I demonstrated, that you can add the procedures to your favorites, or you can access them quickly by my ongoing procedures. And in terms of the products, I think we need to have a look how we can do it product-related things, because for the time being, let's say to add the product to subscribe, product it's not foreseen within the system, but for the procedures, yeah, it's as I've already demonstrated on the portal is possible as well.
Okay,
Nevertheless, just a couple of clicks away. You want to see your product lifecycle as we already shown. Let's see how the experience will guide us towards improvements, but of course we are open to any requirement which is helping the network.
Okay, thank you, Madalena. So here we have an observation. It seems that IRIS acts as soon as there is an MAH submission, but we need information in advance for planning as Annex C. This is very important.
I think we covered this question. So
Okay.
is part of the current process and it's not covered by IRIS, is going to be provided.
Okay, thank you. Next question. Will the access to IRIS be possible from outside the NCA, for example, via VPN, mobile phone, private tablets, etc.?
Yes, if you use your credentials, because you're also using VPN at the EMA and it's possible, you just need to use your credentials and log into the system.
Okay, thanks. Next question. What is a parent product?
So exactly what I was explaining, there are many levels of the product. So for our scope, a parent product, it's basically the research product which is used in the pre-authorization phase. So it's used, for example, by scientific advice, by orphan medicines. It's nothing we are working with in SciMed, but it would provide more information for the applicant, for the network. We have this information also in the other portals, and it's relevant for all the other processes. Now we basically moved in a bigger house with other processes, which has, of course, the implication that we have more information, and that's a good part because we can connect all our activities related to a program.
Okay, thank you. Next question. Will it be possible for MAH to download EMA documents off the site? As per our internal procedures, we will need to inform internal stakeholders with associated proof.
Yeah, just to confirm, all the documents can be downloaded and they are accessible by the map or by the network users. But just also from the network side, let's say, to be mindful when downloading the documents, if it is to read only, so it's fine, but just as it will be presented by Sarah. But if you would like to work on the documents, it might cause confusion because IRIS SharePoint is meant yet to collaborate on the documents, and downloading, working offsite when uploading may cause confusion with different, let's say, versions of some other changes which were done directly into the document by some other users. So this is why we have to keep it in mind. But yeah, the answer to this question is yes.
Okay, thank you, Simona. Next question. For the transition time, it would be great to add the filter for this number. Thank you. So this is an observation.
Yes, thank you. We can take it on board as well.
Okay. Next one. Who adds team member names to Iris?
As it is done now, yeah, it's either taken automatically from the product, and depending on some conditions, let's say for the procedure, let's say if we say that there is involved in the procedure, automatically the prop number is assigned, etc. So it's EMA who are creating the case or leading the procedure. So it's EMA procedure lead and it's EMA assistant. That's all the team members to this.
Okay, thank you. Next question. Is bulk download possible for documents of a procedure for one NCA?
It's SharePoint, so you can, of course, download.
Select more than one document, yeah.
Okay, thank you. Next one. It would be helpful to share links to Iris home site and CRM site. Okay. Yeah, we can include them in.
They will be
Yes.
provided.
Exactly. Okay, thank you. Next, what team members mean for you? I think we give a different meaning.
Okay, for us, that means a case team members. So these are the main case team members. So starting, let's say, from EMA, so it's procedure lead and assistant. And from the NCA, so we have rapporteur, co-rapporteur, peer reviewer, prac rapporteur, and for different types of procedures, it might be prac CHMP liaison or CHMP coordinator, CAT rapporteur, if I'm not mistaken. So we have different types of roles from the NCA side, which are also currently in silent. Yeah. So for us, this is what it means, 18 members.
In the future, when we will include a multinational team, so mean each member, each rapporteur, part of a multinational team. That's also going to be visible. So that the search is really enabled. Of course, we are not including your assessment teams. I think this is where the semantics are a little bit different, but it follows today's model.
Okay, thank you, Madalina. Next one. Assessors are supposed to work directly in Iris. I assume all others, not belonging to the rapporteur team, could read the draft report at any time?
Yes, it's possible to read any time, but also there are some other possibilities how you can start drafting your assessment report. As check out the document that it's not, let's say, the changes you are doing is not visible, but it will be shown in the next slides by Sarah. On the working in ArcShare.
Okay, thank you, Simona. Next question. Is it possible to give limited access to Iris for external assessors to be able to work in SharePoint, but do not see all procedures?
For the time being, the model of access to Iris doesn't allow any access for external assessors. So yeah, it needs to be handled within the NCAs who are involved in the external assessors. Only a person who has NCA email address can request access to Iris. And this is the current model, what was agreed within the network.
Okay, thank you. Next question. We provided a list of contacts to email. Will notifications be sent to all of these contacts for every procedure?
It would be also require some clarification which contacts to email. So if it coming from the slides that we demonstrated that no generic email addresses will be used, but only the main case team resources, as mentioned, rapporteurs, co-rapporteur, prac rapporteur involved in the procedure will receive the notifications. And if it's needed to be auto-forwarded to the other emails within NCAs you may using. So I guess it answers. So for every procedure, yeah, we have only the main team members' contacts and email addresses to be sent out for notification or any communication related to the procedure.
Okay, thank you. Next question. It was on one slide that please do not include confidential information in the report, as this will be sent to MAH. Today we can include confidential information if it is clearly marked PL, then delete that before sending to MAH. So is it not possible anymore?
Principal, it's possible. I'm not sure what was the background. Maybe Sarah, you can help.
Yeah, just to complement, yes, it's just an advice to.
Sorry, I cannot hear you, Sarah.
So I'll start again. So it's just an advice to the assessors, but again, it's possible. So during the assessment, you can include CCI information, and before sending to the marketing authorization holder, of course, on our side, we'll do the check before sending the reports. So still possible.
Okay, thank you, Sarah. Next question. As other member states, we need to have an overview as it is given in the summary of outcome and annex, with timetables, for example, for the CHMP meeting. Is this information given in IRIS? Do we have to search actively for it?
Do you mean the information which is currently in the agendas of the committees, or? Yeah, because it's not clear. So I think this question was already, we need to clarify what type of information is, let's say, currently available on the network portal and could be replaced by the network users if they need, they can retrieve this information, or if it's still not possible, so we can for transitional period still to generate it. But yeah, the idea as well, as I would like to remind you to access this information by each user and using different types of filters or groupings as per your individual needs.
And just to also mention that for the time being, the documents and the data will be provided still in existing agendas and
yes,
right, because we have just a minority of products. So this gives us a bit of time to work together and see what are your specific needs. But just to mention, this is any kind of check is active, because even if you receive an email with a list of all procedures, you will have to check with a Ctrl+F in a Word document, whereas here in a couple of clicks on the portal, you would be able to retrieve your filter information. So it's a very good opportunity and an exciting new way of working. We need to all get used to it. However, the possibilities we have are way better than in a Word document.
Okay, thank you. It is now 11:15, so it is time to go back to our presentation. Let me share again. Okay, I will now leave the floor to Sarah, and she will present the next part.
Good morning, everyone. My name is Sara Santos. I'm also a subject matter expert working for the Regulatory Procedure Management project. I would like to, in this section of the training, I would like to go over some points on IRIS SharePoint and how to work with the documents in SharePoint for the procedures we are implementing starting next week. So starting with some principles on how to work. Sorry, there's a bit of delay. Here we go. So starting with some principles on how to work with SharePoint for IRIS. The way we built IRIS was to have a collaborative environment between the EMA and the network, and in some part with the industry. And so the way we envision working with IRIS is to work in an online environment instead of having to work in silos, in working offline with the sharing the documents from, let's say, EMA to network, network to EMA, EMA industry. So we'd like to have a more collaborative working environment. And that's why when we are working in IRIS and when we are working with SharePoint and the procedural documents in SharePoint, we should work on these documents online. We have the possibility to edit the documents online, and we strongly recommend that we do not download and re-upload the documents. Again, this is a possibility. If for some reason you need to work offline for some limited time, you can download the documents and re-upload them, but strongly discouraged. So that's why we have the possibility to work online, work with multiple people on the same document, up to 50 users. And this is how I envision working with IRIS. Bulk downloading of documents is also not recommended from multiple folders. It is also possible, again, not recommended, as it creates a security risk. And but again, you can download the single documents for some reasons, some particular ad hoc time. You can also download those documents for offline reading. Also, something important to note is that when you are working on a document in SharePoint, you should also pay attention to how you have your document mode. So currently there's 3 modes. You have the editing mode, the reviewing mode, and the viewing mode. To pay attention when you are reviewing a document, or for example, if you are working or looking at an assessment report as a committee member who wants to review the assessment, who wants to comment on the assessment, you should always pay attention to have the track changes activated, just so any change that you make on document, it's easily noticeable. Now some changes or a comparison between what we currently have in our system, Dream, and what is possible with SharePoint. So currently, to give access to the documents to the network, we have to table the documents in MMD to make them visible to the committee members and network users. With SharePoint, there's no need to table anything. The documents will be immediately visible to the committee members. So no need to table documents or links to the meeting folders. The committee members and network users cannot edit the documents in MMD or our internal document repository system. With SharePoint, they can edit these documents, upload new documents to any folder, and create folders. Our current system only allows for 1 person at a time to edit the document, whereas in SharePoint, we can have up to 50 users working on the same document, on the same section, different sections, different paragraphs. No need to, in Dream, we have to check out the file in order to edit the document. In SharePoint, there is no need to check out the file, and indeed, we do not recommend checking out the file, although this functionality of checking out the document is still possible. In both systems, we can have links to documents in other folders. We also have the option to add favorites and to have alerts to our documents. So any changes, we can receive an alert with the possibility of personalizing how we want to receive these alerts. And our current system does not allow or limited the allowance for automated flows, whereas in SharePoint, we can create some automatic flows So for example, we can send very easily a document for sign-off, which also is a functionality we could also do for the network if possible. Or for example, sharing documents with the marketing authorization holder is also very easy to do. So to make the documents available to the committee members, what do we have to do? So with SharePoint, it's very easy. So once the documents are generated in our internal system in CRM, these are going into the case folder, as my colleague Simona showed. So they usually, all your documents, assessment reports, PI, all the documents that you would need for the assessment would be in the evaluation subfolder of the case folder. So no further action from us is needed. So the documents will also be automatically visible to all the network and editable. There's also links to these folders, so the case folder, the submission folder. These links are provided to you within the email notification that you receive within the validation email. So once we validate the procedure, you receive a notification, and within that notification, you'll have the links to these folders. Again, no MMD, no need for tabling. We won't have any UDRLink attachments. The emails themselves will not have attachments. We will work only with links to documents, to folders. And in the future, so it's not yet developed, we will work on the agenda entry. So for now, because we have very limited procedures, we'll still have the agenda items in the agenda as you currently have the process. But in the future, we might develop something regarding the agendas. So having a look now into the SharePoint library, where you'll have our documentation. So the way it is structured, you see you have our main site, which is called CRM. And within CRM, you have different libraries. And within the libraries, you'll have different folders and sub. In this library, you have a way to search for certain procedures or products to find case documents or product documents. And also a committee library where you'll have documentation related to or documents which are not associated directly to a certain case. For example, any guides or lists that would be relevant to a certain committee. So going a bit further into the different libraries that we have in CRM, we have first the submission library. And this library contains folders with the documents submitted by the applicant. And these documents submitted by the applicant, when we are talking about variations procedures or the marketing authorization transfers or Article 61.3, so the procedures we are implementing next week. Again, to remind you that the main submission is still will still be available in the Common Repository. So the submission is still done with the ECTD and the VNIS dossiers. And so in this submission library, what we will have in relation to these procedures will be any working documents which would be sent during the procedure via UDRLink. So any, let's say, for example, any working PI, or at the end when we send the EPAR for consultation with the marketing authorization holder, and it comes and the marketing authorization holder will come back to us. This is the type of documents we will have in the submission library. Then we have the case library, and this is the folder with the working documents generated by EMA, and where we'll have all our documents for specific cases. This is where we'll have our assessment reports, the PI, EPAR, the committee opinions, any presentations. So all documents related to a specific case will be in this library. We also have the committee library. that contains a folder for each committee. And within these folders, you'll have information on documents which are not related to a specific case. Again, they are divided by meeting folders. So you'll have, let's say, the CVMP December meeting from 2023 and so on. So for each month, you'll have one folder. Here, a note that these meeting folders are created automatically by Iris, and you should never create folders for new meetings on your own, or even to edit the names of these folders. And then we also have a product library, which will have information on our documents for the products. And this could be, so not case related, but anything more general on the product you'll find here in this product library. So this is just a screenshot of, for example, the committee library, what it looks like. You have here 2 folders which are pinned. So this is something else you can do. You can pin certain folders on the top of the page, and then you'll have the list of folders for the different committees. Just going back here, one important folder that I like to mention here in the committee library is the first folder, the 00 Iris SharePoint General folder. In this folder, you can you have some trainings, which I think it's important if you have time to look and you'll have some tips as well on how to work with SharePoint. So it's an important folder for you to be aware of, to consult. You'll have some training there. So now talking a bit about how to edit documents in SharePoint. When editing your files, the best option is to edit via open the document in the desktop app. And by how to do this is to right-click on the document and then choosing Open in App. This works for Word documents, PowerPoints, Excel, any of these applications. You can use this functionality. Again, always make sure that you have track changes enabled. And then another tip is when you want to close the document, to use the file. So you would go to File and then Close a menu in the app, in order to close the document rather than use the cross on the top right. Talking a bit about how the versions work in SharePoint. So when a user opens any document in the browser or in the app, the document gets a partial lock. And what it means is that other users can still edit the document, but this document cannot be deleted or renamed or overwritten with a new version. Also, that's what happens when you check out a document. You have the possibility to check out and check in a document. And this is particularly interesting when you want to label a certain version of the document. So let's say as a rapporteur, as an assessment, you are finished with the preliminary assessment report. It's useful to do a quick checkout and check-in of the document in order to label that version as the final preliminary assessment report version of the document. So regarding the versions, a new version appears every time a single user opens a document in edit mode, even if no modifications are done to the document. To this, what we are trying to implement here in EMA, and also would like to extend to all the network, is that when you are working with a document in SharePoint, you have the option to protect the document. This is done via the File menu and then Info menu. There's an option to protect the document. This will make the document protected in a way that when you open it, it will open in the read-only mode. And then if you want to edit, then you actively have to click on Edit Document in order to make modifications. This will reduce the number of versions that are created. And it's something that we highly recommend everyone working on these documents to do. So on our site, EMA, we'll try to, when, for example, generating the assessment reports, to have them already protected. So no further action on this needed. But any documents that you would upload or are created by the network and uploaded into Iris, into SharePoint, this is something that we would recommend you to do, to have the documents protected. Some notes on the versions. So when multiple users co-author the same document, separate versions are not created for each user. So both users are still working on the same version of the document. That's why it is important to have the track changes enabled. Then it's possible to restore an old version of the current version, and this does not delete any version. So if for some reason you would like to restore some older version as the latest version, you can do it, and that won't delete any version. And it is also possible to delete any version from the version history, although this should not be necessary. And the next slide. Right. Checking out the document. So the way we can, oops, sorry. There's a bit of lag between.
I think it's earlier. This one.
Sorry, Katrina, could you go one slide before?
Before, okay. No, this was the one you just presented.
Right. Then to mark, another possibility in SharePoint is to have the document you are working on marked as final. Sorry, could we go back?
Here, right? Okay.
Yeah, slide 29, we can see now on the screen.
Okay, checking out the document. So we were going one slide before. Like I said, it's not recommended to have.
Stay on slide 39.
Okay.
It's not recommended to have to use the checkout functionality, but if you'd like to, let's say, lock the document, especially if you are the rapporteur or the assessment working on the procedure, if you'd like to lock the document to not allow people to edit, you can use the functionality to check out the document. And the way to do this is by selecting the document you want to check out, go on more, and then you have the option to check out. Once checkout, again, the user can edit the document. No one else will be able to edit the document unless the document is checked in again. And what is most useful about this functionality is really when you check in the document, you are able to provide a comment on that version so that the specific version is labeled. Next slide. Another functionality is to mark the document as final. So it's very similar to what I've just mentioned about protecting the document. So it means that when you open the document, it will open in a read-only mode. And again, any user can override this and also, again, edit the document once it's marked as final. Although you'll do receive a notification, like we have in the slide, that this document has been marked by the user as final. Again, it's weak protection. It's mainly for an advice, but you do have this additional discouragement to not edit further the document. Next slide. You also have the possibility to create alerts for certain documents or even folders. And the way to do it is to select the file or the folder you would like to receive alerts on, and right-click and choose Alert Me. This will then open a window with some possibilities on personalization of these alerts. So you can choose to receive these alerts by email or by text message. And you can also choose the timing when you want to receive these alerts. I would not recommend to choose the immediate notification, as this will clog your inbox. But it's useful to have a daily or a weekly email with a summary of the changes made to the document or to the folder. Your alerts can also be you can check your alerts in one place. And I leave here the link where you'll have this overview. And this is where you can also modify and manage the alerts you have on the different folders or files. Next slide, please. You can also have some files or folders marked in your favorites. And again, to do that, you can right-click on the folder or document you want and select Favorite. And also, you'll have a page with all your favorites called My Content in Microsoft 365. Again, where you can also manage which pages, which folders, and which files you have as your favorites. Next slide. Some not to-dos in SharePoint. Again, we advise against downloading the files and working offline. Again, if it's needed, it is possible to download the files for reading offline, but we do advise to work on the documents online with a connection to the internet. We advise against deleting files, as there is no personal waste basket, and you cannot restore these deleted files after 30 days. So instead, what you advise is to rename the file as obsolete, and this way you'll have it there, and no need to have it deleted in case something you need to restore it days after, and it's a bit difficult to once deleted the file to find it. We also do not recommend checking out the files, as it's not necessary to edit the documents. And again, 50 or more people can work simultaneously on the document. So again, we're trying not to go against our aim for the collaborative working. Again, still possible, not advisable. We also, you should not use the share function that you have in SharePoint to share documents with non-EMA users. This will not work, and this is due to the access rights we have in place. What you can do instead is to right-click on the document or the folder you want to share, and you can right-click on it and select Copy Link. And then you can have the links shared with the persons you want to share the document with. Again, if they have the right access, they will be able to access the document through the link. If not, it's also a security measure. If they do not have the right access, they will not be able to see the document or the folder you are sharing through the link. You should not create new folders for the committee meetings, or you should not create meeting folders. you can create subfolders, let's say in the case folder or in the committee library, but not related to the meeting. And never rename the committee folders, so they should have all name that has been assigned to them when we create them automatically. So you don't need to rename any meeting folders. Next slide, please. Another thing is you should not create multiple files for the same document. So let's say if you are working on an assessment report, we should aim to have one file for that assessment report. If for some reason you need to download the file, you can download it and then re-upload as long as you have the same file name. This will then, when you are re-uploading the document, it will save a new version on top of the existing version. And you should work with the more recent format files. So the formats DOC or PPT XLS will create new versions of new files of the same document, which we do not want. So always, if you download the document or if you are re-uploading, make sure that you have the same format file. So this is the docx, PPTX, or XLSX. And it's not recommended as well to have multiple levels of subfolders. So a subfolder inside a subfolder inside a subfolder, as this will create some difficulties in the search option, and it will turn things a bit more confusing. So try to stick with, let's say, 1 or 2 levels of subfolders. Next slide, Katerina. And I guess this
Yes, now we have, thank you, Sarah. Now we can head over to our Q&A. Okay, so here are the new questions we get. First one, is SciMed going to be completely replaced by Iris in the future?
Yes. I answered that question already.
Okay, next one. No images were seen when showing all the cases for one product. Could you please show it?
And just, go back and show.
Okay, you can start sharing. Okay, perfect.
See?
Yes.
That's why you need to select the product which you'd like to search. You should be able to see all the cases which are related to that product. So that we have able to see it related to that product. As Madrina demonstrated, you can use the filters if you would like to narrow it down. If you are only interested in the specific types of procedures, you can just use the filters. I hope now it's visible by the attendees. Thank you.
Okay, thank you. We'll go back.
I think that we should use this now question and answer session to go to the more Iris SharePoint related questions.
15, yeah, I think it was right.
Yeah, let's say now these are the most upvoted questions. So for example, here we have, who will be responsible for version control of the documents in the shared space?
So versioning is automatic. Like I explained in the presentation, each time someone makes an edit on the document, it will be registered in the version history of the document together with the time the change was made and the name of the person who made the change. So this versioning is going to be automatic.
Okay, thank you. Here we have a question on SharePoint. It would be useful to add team members to a case in the SharePoint site and notify these people of any changes. Would such an option be possible?
Yes, so any team member working on a case, they will have access to the IRIS SharePoint together with the network portal. And each person individually can create their own alerts to the different files or folders they would like to be alerted to in regards to the changes. And they can even personalize when they want to receive these notifications, how they want to receive it, and for which modifications they want to receive notifications. So let's say any change to the document, or even let's say changes which were done not from a person different than the user. So they can manage their alerts in their own dashboard.
And so you can also,
Okay, thank you.
Katerina, just to the
Yes.
question, you can tag your colleagues to alert them that you need a feedback. They will receive an email notification exactly to the paragraph the user has put a comment. So it's a very, very flexible system.
And also, in addition, even if I'm not a team member for that case, for that procedure, but I have access to IRIS, I can just select any of the case or subfolders for which I'm interested in. And whatever changes within the document, there is an option which I would like to receive the notifications. If there are any changes, I will receive a notification. So it's just here to make it easier for any user of the system.
Okay, thank you. Another question, can multiple assessors access a document at the same time?
Yes, so SharePoint allows up to 50 different users to access the same document at the same time and to edit them at the same time.
Okay, thank you. Then, so we have these two questions who are voted. Here we have the 19-digit numbers of the case can be reused for different cases.
Has been responded in writing. It's from the previous session.
Okay. Here, we still do not have Microsoft 365 in our NCA. Does this handicap the work in IRIS, for example, with the favorites?
You mean Office? Or the CRM, the case management system?
All right, SharePoint. You should have access to the SharePoint through the browser. And from there, you'll be able to work with your favorites. So it shouldn't be an issue.
Okay, thank you, Sarah. Next one, are comments still sent by email or through IRIS?
By email or IRIS. If the procedure is in IRIS, so all the emails on our side, let's say they are coming through the IRIS system. So this is, I think the question is more about how to provide the comments. So as we mentioned, you can provide them either directly in the document on which you want to provide the comments, or you can upload the separate document with your comments. But just also keep in mind that as now within IRIS platform, we don't use UDRLink and we use the Outlook system emails. So just to be careful not to put confidential information within the email as such as a text. So that's why there is a links with SharePoint location where we can access any additional information, including confidential, etc. So this is, I think, this is also important. So either you enter the comments directly into the document on which you want to provide, or you upload a separate document. And if you see that there is also the option that once you provide the comments, you can tag the rapporteur. This is my comments, please find. Or you can send an email to the whole committee Utranet mailbox or to the rapporteur directly. I entered my comments if you would like explicitly to let him know, as you are doing it right now, sending them an email. But no, it's not advisable to put any comments in the text subject within the email as such.
Okay, thank you. Next one. We had our struggles with SharePoint in our organization when multiple users were working on the same file and some of the changes were not seen in the document after checking out, checking in. Has SharePoint been tested out appropriately for using IRIS?
So yeah.
Here I see some, from my understanding, so you have the document checked out and then you cannot see the changes. So again, we discourage to have the document checked out in order for everyone to be able to work on the document online. Because if you have it checked out, then you cannot make, as a user different than the one who checked out the document, you won't be able to edit the document or do any changes. So if you have, you always need to have the document checked in order to have multiple people working on the document. So I think this is
Okay.
the question.
Thank you,
I'm
Sarah.
always to have the document checked in.
Okay, so next one. Will the rapporteur be eventually the one responsible to decide what to accept or not when there are comments and modifications from 50 people? Wouldn't that increase a lot the workload for the rapporteur navigating among many changes and comments?
So this is the capability of the system. However, if we agree to a way of working, let's say comments should be only provided as separate documents, just to ease the workload of the rapporteur, and only the rapporteur's team will work, or the teams will work on effectively on the assessment report. That would be one of the options. So that's something we could test and agree and see actually what is the interest of a certain report or document, and if that impairs actually the assessor's work, then we should keep the comments outside. I don't know if there are other comments.
Yeah.
Okay, so our 10 minutes of Q&A are over. So of course, please note we will respond to the remaining questions in writing, and we will publish a Q&A document from this session. So now we'll go back to a presentation so that Simona can present next steps. But before, I will launch a survey, just a quick survey of 3 questions where you on Slido, where you can leave your feedback on the session. Thank you. So let's go back to a presentation and handing over to you, Simona.
Thank you, Katerina. Just, an overview of our planned next steps. So just to inform you that tomorrow the final user guide for network and frequently asked question answer document will be published on the IRIS portal as well. So this is going to be a live document, and it can be to be updated on a regular basis as we identify any need, or you will provide that there is important information missing, etc. We did this consultation with our network SMEs, which we had 2 of them on our team. And now we finalized those 2 documents, and they will be made available to all the network users. Also, just to remind on the rollout of our type of procedures and for pre-selected products, as already mentioned, is next Tuesday, 23rd of January. And just also to remind that the technical webinar will be will take place in the mid-February. Still, the exact date is not yet agreed, but the IT directors has been already informed as we received some requests from different entities, and we tackle some technical questions there, including some, let's say, NCA specific requirements to make sure how we could support those. Especially through the transitional period as well. And the next public system demo, as you know, the teams didn't stop their work. We continue working on the systems, on the network portal, on the industry portal as well, and new functionalities or improvements will be constantly implemented. So just a reminder for you, if you would like to follow on the new upcoming improvements, you can just log into the public system demo organized by EMA Portfolio Board on the 26th of March. And the next slide, Katerina, I think we can go. And this is just to show the location where all the different documents will be published, or any other access for more information and the guides you can access just for you to easily navigate through the SharePoint locations for those documents as well. And our last slide is on support. If, let's say, going live, if you will experience any technical issues, how to report those, or you have questions more on Iris, or still you will have a procedure lead or scientific EMA assistant who will be managing the procedure within the system, and you can also directly liaise with them on some specific questions as well. Just maybe to reassure, we'll have a team as well working on some urgent issues if there will be any identified or any bugs once we go live, so that we could react very quickly and to respond to those things and to solve them as soon as possible. So this ends up our presentation for today. And we would like to thank to you all for your participation, for your questions. We'll continue replying to those questions in writing. Thank you very much. It shows a huge interest and understanding. Actually, this is what is, I think, the most important, that your questions really make sense, and that we understand how we are going to work through the Iris portal, but also your thank you for being patient as well, as the system is for those types of procedures is new to all of us, and collaboration, patience, and it will be very important as well, and trying to build the system as possible to answer all our needs and to benefit, first of all, also from different functionalities and capabilities of the SharePoint network. So thank you very much.
Well, I would also like to personally thank you for your time and your interest. We are heading towards very exciting times, and please count on our support. And we are grateful to have your suggestions and participation. So you have some contacts there in the slide. Please reach us out. Please reach Simona. She's our lead on communication with the network. We are working together to make the system suitable for the entire network, and we are really looking forward to have your feedback and based on the Go Live experience. Sarah?
Just thank you for your participation and interest again. And like Madalina and Simona said, we're very happy to go for this new phase of the project. And of course, you'll receive any support from our side in order to have things working correctly and trying to smooth the process in this transition time to this new way of working. Thank you.